If you've been in the NICU for a while or you've had a baby who's been born prematurely, your baby may have had an eye exam. Almost every baby who's born prematurely does, and what we're looking for is something called retinopathy of prematurity. That's a big word that really boils down to blood vessels in the back of your eye on your retina and how they grow. When babies are born, the blood vessels in the eye stop growing for a little while because the baby is exposed to much more oxygen out here in the world than the baby gets from you inside. And that's okay, that's supposed to happen. But when you're born prematurely and you're exposed to all this oxygen, over time you may even get exposed to more oxygen in the NICU and some other factors, and the babies tend to have, the vessels are growing in a tortuous way. They can even pull up and cause the retina to become detached. So what the eye doctor is doing is looking to see how the vessels look on the back of your retina, the baby's retina. They're looking to see whether it's still nice and flat, whether the vessels are growing in a straight path, and if they have any concern, they'll call a retina specialist in to look at your baby. If your baby has retinopathy of prematurity, it's graded in several different grades, and some of them we just watch and others of them we actually will intervene and give therapy for. The most common therapy for retinopathy of prematurity right now is called laser therapy, and that sounds a little scary, but in fact it's very safe and has been proven very effective for retinopathy of prematurity. So if you have concerns about retinopathy of prematurity, which is also called ROP, you should talk to your nurse or your provider and ask them to explain it to you a little bit more. There are pictures they can show you, and just know your baby, if it's born prematurely, will likely get an eye exam and several eye exams over time. And after you go home, you'll continue to see the eye doctor until all of the retina is nicely grown, all of the vessels look normal, and the doctor will transfer your eye care over to your regular provider.